that can be treated well. So this is not a single drug which helps, but along with that, according to the doshic conditions, the other kashayas sort can also be also has to be prescribed. Only then clinical success can be achieved in a better way. We have many such first-hand preparations which can be prepared in the clinics and can be used, like simple preparations. We have in Ashtanga Hridaya also, or in Sarasya Yoga, it is also explained the Bakuchi Haratara, wherein Bakuchi with 1/4 part of Haratara mixed with Gomutra, prepare a lepa. For using externally in cases of vitiligo in Shutra, it is a very good preparation which can be effectively used. Even in clinics, we have seen the results with Bakuchi Haratara. In Loma Shatana, we have Pinda Haratara Basma, Pinda Haratara Churna. It's a simple preparation. Pinda Haratara has to be subjected for Shavana. Keep it a powder ready. Whenever Loma Shatana patient comes, to this Churna add Shankavasma, add any of the Ksharas like Kankana Kshara or Shankavasma to it, mix thoroughly and apply. 100% you will get the results. I have been using in my clinics this Loma Shatana Churna, explained in Shrinivas. We have very good results with it. It definitely kills the germinal layer of the hair root when it is used instantaneously after the plucking of the hair. So these are the simple preparations which you can keep it in your clinics, ready hand, which you can dispense to the patients. One more important preparation is Mayura Pichavasma. Very important was first hand drug. You have to keep it in your clinics always. If you don't have also, you can prepare it instantaneously and give it. Mayura Chandrika Vasma also it is called as. In cases of hiccup, this Mayura Pichavasma. Take Mayura feathers and do Vritavarjana, you get a Vasma out of it. It gets charred and it is not a masi. Why we don't call it a masi? This Mayura Chandrika Vasma contains a rich amount of copper in it, and definitely it has its action over the vomiting centers and respiratory centers in the brain, because of which the Vegas can be immediately controlled. So this is a hypothetical way how this Mayura Pichavasma do act in such conditions. But whenever there is a chronic, whenever there is a severe hiccup, patient is not under control. Every 5 seconds, 10 seconds, he is coming up with a hiccup, vega. In such conditions, just a pinch of Mayura Pichavasma with madhu every 30 minutes until the severity comes down is usually administered. This is my clinical experience, what we have seen. And thereafter, the dose was, when the whole thing was controlled, thereafter the dose was reduced. So very fantastically, we do get such results with Mayura Pichavasma. We have certain preparations from Tarangini, wherein he says Sasyaka Dravaka, a simple Sasyaka, Shodhita Sasyaka mixed with water. This you can keep it ready. In all inflammatory conditions, for wound washing, for conjunctival diseases, for vaginal doshes, you can use this Sasyaka Dravaka whenever vaginal wash is needed, whenever there is a whitish discharge or infections of the vaginal. In all such conditions, Sasyakadravaka can be used. Very simple formulation, yet effective formulation, which you can keep it in your clinics always. Another formulation you all know, that is Shatadvatamrita. Isn't it? How this is prepared? Isn't it? With washing the Vrita in water. By changing the media, you can use this Shatadvatamrita in a different way also. Instead of washing with water, you can make use of any of the kashayas. Yashtimadu kashaya. For instance, Yashtimadu kashaya. If you use Yashtimadu kashaya, such Shatadvatamrita can be used even in pronouns. Isn't it? So if you can make much more better, you can make much more, you can get much more better results with such Shatadvatamritas, which are prepared with different mediums. One more in Sharangara, he says about Churnodaka. In Tarangini also he says, whenever the baby has a curdling, whenever the baby doesn't get the milk digested, it vomits out the milk whatever is ingested. So in such conditions, a half teaspoon of Churnodaka, if it is administered, that cures the curdling. A very simple remedy, very effective remedy. Even in pediatrics, whenever there is a curdling, Churnodaka is administered. How this Churnodaka is prepared? In the same way as Dravaka, he says. 2.5 rattis of Churna in 5 hours of water and filter it. So this Churnodaka, a half teaspoon of Churnodaka, if it is made to drink, that curdling of the milk in the pediatrics can be avoided. So such simple preparations can bring you a success or can bring you confidence to practice the Rasoushadhis in your clinics.
Thank you, sir. One more thing I want to ask from the end of the audience regarding the Rasoushadhi and all. What is the time duration where we can administer the Rasoushadhis? In some of the Rasoushadhis, they have been given Mandala, Sirita, Sesham, Anti, Kulkarni, Sheshakana. So many of the audience will be having this doubt. Rasoushadhis are the best. I don't want to say that Uttama Rasoushadhis, always there are Uttama who practice Ayurveda. But if when you are administering any sort of Rasoushadhis, so what will be the time duration for it? It will be Gandhi Shamana or is there any time duration?
One mandala is usually used. After one mandala, we have a break for 50 days. And
the saturation, we are 15 days of time and then again we are starting with this. What we can see from this discussions are, we people just write it down, whatever sir has said, we write it down, so we practice it, but we will not make any effort to go and see back whether it is given in Samhitas or something extra is given. Everything we are very instant. So if you don't rely on Samhitas, on the books, the days are not far where you will get the book in the market, how to become an Ayurvedic doctor in 30 days. Right? How to learn Sanskrit in 30 days, how to become an Ayurvedic doctor in 30 days. This book, these days are not very far. So, my request for everyone is, try to open Samhitas, try to read, try to understand, and without tika. Right? It is going on a travel with a bike without petrol. Without Samhitas, without tikas, if you are reading Samhitas, you won't understand everything. So now over to Wadeyar sir.
Very correctly said. that without the proper knowledge of the dravyas which you get from the samhitas, it becomes very difficult of understanding what you are doing. Because what will happen is the second case you are going to fail. If you hear to somebody and give some yoga, the very next case it will be a failure because you have not understood the underlying concept. And Ayurveda Vaidya gave an hematinic. He diagnosed it as a Panduroga based on the decreased hemoglobin levels, and he gave a hematinic. So the problem was that after giving that Aushadhi, what had happened is she was a female patient and she started getting periods again and again. So because of that, again, there wasn't any significant increase in the hemoglobin levels. We have a lot of these Pandura dravyas. So before that, a very important point regarding how great our Samhitas. You know Pandura, right? We correlate it with anemia, right? It's grossly. What is in Agrasangrani Adhyaya? What is the best drug for Pandura? Rasna Vata Harana, Vasa Rakta Pitta Harana, Panduroga Harana. Yes, Ayoraja, very good. Ayoraja Panduroga Harana. Ayoraja Panduroga Harana. So iron is a Panduroga Harana. This was discovered by our Acharya as well. Right? You know heme, the molecule, the pyrrole, the alpha beta chains you have learned in the physiology. It's in the syllabus. Right? Because I taught some physiology also, Sharira Kriya, to my students who come for Samhita reading and all. It has pyrrole rings and all. The central molecule is the iron and it is ferrous form. Fe2 plus not ferric. Right? Okay. Now, we all read this. Ayoraja Panduroga Harana is written in Ashtanga Sangraha Agrasangraniya Adhyaya. That is the time when Shali's hemoglobinometry was not there. We agree with this or not? We started studying, that's the humankind, started studying line to line analysis of metabolism on our when? Can anybody tell? Right? It's after 1930 or 1940. Why? Because electron microscope was discovered after that. Then you came to know there is something called ETS system. There is cytochrome inside and iron is there. So we told, see, for Panduroga, Ayoraja, iron is given. He could have given Amalaki, he has given. He could have given Palak, he has given. They are all secondary. No, the most important drug, that is iron administration, without estimation of any blood, without CBC, they have given Loha. Oh, extraordinary it is. Isn't it? We should be proud of this. Isn't it? How Charaka Sushruta and Vagbhata were there. No investigations, no blood test. They diagnosed it, not only diagnosed this, but the administration of Loha itself, not zinc, not lead. It's only iron only. Now the question comes, the case which I discussing with you, our dear Ayurveda Vaidya, he gave yoga which contains iron, hematinic, and it started producing what? Puna Rajapura. And you all know. So what had happened is, he has given Kasi Superstar. Right? We read both, sir. We read Ayurveda as well as in physiology, we read the GK Pal and guidance physiology also because it is in the syllabus. He read in the syllabus, it is clearly written that ferrous sulfate is the best iron form that is to be given. It is given in the Harrison and other medicine books also. So ferrous sulfate is Kasi Savasva. So he is told, see what is available in the market, Kasi which you get and you show and all, is ferrous sulfate only. Ferrous sulfate. So ferrous sulfate was given, and what is Kasi, sir? Right? And Ayurveda Vaidya, he has studied, not going into the depth like what is the guna and the karma. Where is Kasi mentioned? The most common yoga of Kasi is Rajapravartini. So Kasi is an iron preparation to be given in Panduroga, but it is a Rajapravartini. What is this? So that is what has happened. Nothing can go beyond the words of Charaka. Na matra matra maktatram hinchidagam avajjikam. Right? Isn't it? So you got the point. The administration of ferrous sulfate was not wrong or right is not a question. What is the guna of the Kasi? Isn't it? It is Ushna. So what our friend told, he rightly told Ayoraja. So has he told the use of Ayar or Ayoraja? What is Ayoraja? What you will mean? Huh?
Raja means Churna.
Raja Churna. So Churna of Aya. I will say Aya is there, it has a Raja over it. Then what you will mean by that? Not. It's very simple. Huh? Mandura. Isn't it? So Loha is also administered. Aya Raja, as he correctly interpreted, Aya is Loha. The Raja means he told Raja Kshoda. As per Sharandar Samhita, it is Churna. So let us take it as Loha Bhasma. That is one part. That's also very right. You know the yogas of Loha. Now I said Loha. We have Kasisa, but Aya Raja is Mandura. Okay. Then Mandura is also a Pandura. Now, these were all that again I will repeat before Shali's hemoglobin is discovered. So, the iron was used, the Mandura was used, Loha was used, and Kasisa was used. Abraka was used. As Sir rightly pointed out, Abraka is given. Why Abraka is to be given in such conditions? We will come to that. Now, what has happened here is the Loha cannot be given directly. How it will be given? Loha is given in the form of Loha. Are you going to rub and give it to you? No. What you will do? We will convert it into Bhasma. This all procedure is one thing, and what is its Virya is very important. Isn't it? What is the Virya of Mandura? Manduram Shishiram. So, we have iron preparations. One is Ushna Virya and another is Shita Virya. Oh, magnificent it is. So fine for what we call as pharmacokinetics or whatever term we use today, right? So was finally found by them. They were so brilliant in this. They were going to administer bits from now. You know that you have done some extra Rasoushadhis, right? These bhasmas of all dravyas are of two colors. Some are red and yellow color, and some are black color, right? So going grossly, what are these? One is oxide and another is sulfide. So these ferrous sulfate, which is sulfur, that is the culprit. That is Ushna. Because of that, what happened is the changes came like this, right? But Mandura, which is Shishira or Shita Virya, that also increases the hemoglobin. He says Mandura to be given in children and adults, and Sukumara, for them the Mandura is given. Otherwise, Loha is given. So by Samskara it will become Ushna Virya. By Samskara something becomes Shita Virya. But what is the basic property of that will not change. No? So what I want to say is that you select the iron preparation drug means which you are going to select in that condition. That is very important. So in the conditions having Punah Raja Pravritti or dysfunctional uterine bleeding, DOB cases, or Pradara, what we give is normally we give Mandura Bhasma. When we give Mandura Bhasma, in certain cases we observe that properly prepared Mandura Bhasma, the hemoglobin levels which are dipped to 7 to 8 increased to 13 within 15 days. In one case it happened. In other cases it took 2 months, 3 months, because there are a lot of other factors that are involved in Pandava. What is the gravity of the Pandava? Isn't it? Soul, Parasol, Prametas, Kanisa, Shitila, India. So a lot of changes occur in them. Again you have to read the Samhitas. What is Pandava and how it starts. Arohana Ayasa is the most common term used. There is a lot of changes like Varna Vyathyasa and the lack of what we call, like in Kamala we say, Kama Nala Ati Kamala. There is no desire to do something. That is observed. That fatigue, immediate fatigue that is observed. They are all very beautifully mentioned in Pandava, isn't it? Now which drug you are going to select for that is very important. Isn't it? You got the point. Depending on the virya, the things will change. Sir rightly pointed out regarding the Abraka Bhasma, the usage of Abraka Bhasma. You should never forget it, especially in the respiratory disorders and all other disorders. And it should not be used directly also. And the Shadguna Balijayaka Gandhaka Siddha Bharata and its preparations is a very extraordinary concept. What we are using is the lowest form, like we said Trivishisha Buddhi Itta. We should be able to make understand a Manda Buddhi also. Like that, the lowest level, lowest strata is using what Bharata we are using today. Eke Nadashna Ena Apshuddho Bhavati Bharata. So that's just for namesake, right? I am not contradicting. Why there are other principles? So we have again traced out from the 10th century to 18th century, a lot of Rasa books were written. And I discussed about Rasapadhati. Another book is Rasendra Chintamani written by Kundukanatha. He says, don't give Rasadravyas. It is about Rasashastra. He says, don't give Rasadravya. Why? Why, sir? Why you should not give Rasadravya? If you want to give Rasadravya, do a Rasa Pratignya. Rasa Pratignya is what? Rasa Gunapalija, Nandina, Na Raja, Hanaksham, or Rasenka, Na Jala, Kaladu, Tapakahi, Na Sufficient Rasayam, Kam, Rasa Prasati. रस प्रतिज्ञा इति पाठान्तरः. What is rasa pratyajna? Rasa guna bali jaranam vina न रुजाहरणक्षमो रसेन्द्रः. This Rasendra or Bharata cannot cure disease. It's used in Arabhi, it is used in Kachili, it is used in Aprakaparpati, it's an ingredient of Shankavati, right? So the Bharata which you are using should be what? Rasa guna. Rasa means what? Shadasa. Shadasa means 6. Rasa guna means 6 times. Rasa guna bali jaranam. Bali is 6 times. Jarana kriya of Gandhaka should be done on Bharata. Bharata should be subjected to Shadvida, Shadguna, Gandhaka Jarana, Bali Jarana. Rasaguna Bali Jaranam vina na Rujaharanakshamo Rasendra. The Rasendra cannot get the capacity to do Rujahara. That is his principle. The principle of Rasendra Chintamani, which is a first book. Now, then he says, Na Jalada Kaladhota Pakahinaha Sprushati Rasayana. It cannot do Rasayana work. How? Without Jalada and Kaladhota. Jalada is what? Abhraka. Jalada is Abhraka. Abhraka is the paryaya of all Megha. Right? Not Meghaduta. Right? Jalada. Kaladhota is Varna. So all these are, they impart what? They impart the quality of what? Rasayana. Na jalada kaladhota pakahinaha sprushati rasayana kamti. This is what? This is rasa pratijna. Everybody has to do rasa pratijna before he wants to give rasavishana. That is what one point I wanted to add. This is one point. Now we will take a simple case. Is it ready? It's not operating. Okay, right. So you got the point. So for administering the rasadravyas, you need to know what? The gunakarmas also. Isn't it? If you want to give abhraka, what is the virya? So it is given in the text, no? Gauri teja param uttam madrika kshayatnam pradnya bodhi prashmakarjam deepanam shita virya tattat yoga sagala gadar vyoma sutendra bandhi. So, like I told, in simple, to make you understand in very simple terms, what is it? The Loha has a different virya, Mandura has a different virya, and Kasisa has a different virya. It's not that either preparation like a ferrous sulfate or an oxide we can give. We have to follow the proper virya and what are the yogas where it is mentioned. Right? In our Jaipur Parampara, my Guruji, they used to give Mandura with very simple yogas. As sir rightly pointed out, don't use this Basmas directly, mix with something. What is that? Mandura is to be given with Amalek. It's called as Mandura Amriti, very simple yoga. Right? What you have read in the first and second year students, like you have read in the physiology that vitamin C is to be given in iron absorption. It's required for iron absorption. Is it one reason? There is another reason for that. What is that? Converts from ferric to ferrous form. Fe3 plus 3, Fe3 to Fe2. That's the real form in the body. Isn't it? Fe3 is toxic. So, how they understood? Without electron microscope and without this hemoglobinometries, Charakyan Sushruta clearly mentioned, or our friend told, that is Ayorjaha Pandarogaharana. We agree with this or not? Right? Are you proud of Ayurveda or not? Yes, you have to be. Because they are written like that. You have to practice like that. Or to practice that like, you have to read like that. Isn't it? Adhyayana is very important. What is Adhyayana? Adhyayana is what? No book tells you to do Adhyayana. Adhyayana is wrong. What is right? Swadhyaya is right. Swadhyaya. Adhyayana should have a prefix. It is Swadhyaya. I should read for myself to earn money? No. To treat the patient. So Adhyayana is very important. Right? So before going into another case, just I will give you a simple clue. Like you were wondering so many Sindhura, Sir told, Bhasma and all. Right. Now what is the fundamental principle of administration of Rasoushadhi? So many books are there. Chintamani, Chudamani, right? Rasartha Samuchaya. I told Rasardaya, you should begin with Rasardaya Tantra first. Then you should end up with the Rasendra Chintamani. Minimum 10 to 15 books you will get, right? So, sir, we are not having any time, right? Not for that reason. But you should understand what is the fundamental principle of administration of Rasadravya. What is that? Right? Charaka has explained? No, he has not explained. Ashtanga Hridaya has not explained. We feel like that, isn't it? So can I ever read it? Like I told, you should observe the Virya and all, there is one part. What is the fundamental principle? You have Ashtanga Hridaya with you or Charaka? Ashtanga Hridaya you have? You open the Rasavedi Adhyaya. Very good. Okay, you opened it. So you have Madhura Dravyas. Madhura Dravyas, which are the Madhura Dravyas mentioned list of Madhura Dravyas? Along with the commentary you have, right? Ghrita? So, Ghrita, Hema is there. What is Hema?
Swarna.
Right. That is what I wanted. So, the principle of administration of Rasadravyas are same as the principle of Rasoushadhis. What is that principle? Tatra dhyama kandhanti, pres diktadaya kapam, kashaya dikta maduraha, dikta mandetu kurvate. So, when you want to administer Swarna, why are you administering? Because you should understand that Swarna is a Madhura Dravya. Now you open the Amla Gana. Amla Dravya, what is mentioned there? What is mentioned? Rajata is mentioned in Amla. So, Swarna is Madhura, Rajata is Amla. So, like that, it will consume time. So, Loha is like Tikta or Kashaya, right? So, you will get the various Trapu, Sisa, all the Shadlovas, right? You got Swarnam, Rajatam, and everything you will get in the Samhita itself. You got? They are by Madhura Prabhava, right? They are going to act, and that is the fundamental principle. You got the point or not? So don't fear to your Rasoushadhis. The fundamental principles are the same. So, like first when I gave Rasoushadhi, when I started my OPD, do you know what it was? It was Rajata Bhasma. I gave Rajata Bhasma with Madhu, right? In Shirashula. For a Shirashula case, I gave this Amla Dravya. Why? The Shula is there. To give Shula, you require what? Vatahara Dravya. Which are those? Tatradyamarutam Ganti Madhura Amla Davanani. So I gave Amla Dravya, which is Rajata Bhasma. Right? In very minute quantities. And that's also very effective. So you should remember that the whole principles are based on the principle of the what? Principle of the Rasoushadhi only. Our Samhitas are enough to explain this. Now, when you want to read all these other Samhitas of Rasa Shastra or yogas, you have to go into the deep depth along with the commentaries. For example, one of the common used Rasoushadhi is Makaradhvaja. It is used as a Vajikara, it is used as a Vatahara also. Now, how Makaradhvaja is given? Now, we are giving pills, 2 TDS, 2 VD, 120 mg, 250 mg, 500 mg, whatever it may be. Now, this Makaradhvaja, right? Makaradhvaja you know. Majority of you know, I think, right? So, Makaradhvaja is to be given with Mandaka. It is mentioned in Rasendra Chintamani. What is Mandaka? It is very closely available here in Belgaum. It is called Mande in Marathi. It is known as Mandige in Kannada. Mandige Vattal. So, Mandaka. So, along with Mandaka. Now, the commentator of Rasendra Chintamani, in Maniprabha commentary, who happens to be a principal in the National Institute of Ayurveda, Jaipur, he interpreted Mandaka as what? Rumali roti. The Punjabis and all, they used to eat the Rumali roti, right? Rumali roti, you know. So that was having a sweet taste or converted into a sweet taste is Mandaka. Mandige, convert. So that is how that Vajikara effect is got by that, or Vatahara effect is produced by this Anupan. Not Pana, it is a Khadya. Adbhuta Khadya. Right? That itself is a Vajikara. Right? So this is the method of technique. We have forgotten that. Right? We forgot that we have a day earlier. Right? We became human, we are considering ourselves as Buddhiman. Our Buddhi is where it is in the Samhita. We have lost it, isn't it? So we have to get it back. We have to read. See, there are 4 lines. Makaradhvaja is how much? 5 lines, 6 lines, 8 lines. Not more than that. And how many times you have to read? Read once. I have read once only. Just I opened it, I got the references Mandaka. Our teachers in Jaipur, they were giving with Mandaka only. So that's why we started giving in cases where it is required along with this. Now we are taught what? We are taught you 2 pills of Makaradhvaja, morning, evening, night. It will act as per its way, like the Kasi said, right? In that way it is going to act. Right?
Continuing with Pandu's example, it's, the same Samhita it is also explained. In Pandu Vikara, specialized treatment has been explained by Acharyas. So whenever whoever is suffering from with Pandu, he has to be given the water in which the hot iron balls are being quenched. Hot iron balls. So iron balls has to be heated a lot. then this has to be quenched in the water, and that water has to be made to drink. This is nothing but a concept of ionic water. Long back, Acharyas had explained this, and nowadays Madhuri Dixit is explaining to you people in the form of copper water. Isn't it? So similarly, a golden ionic water was given for improving the Medha Shakti. For improving the Medha Shakti, or even during a Pumsavana, a golden male baby doll was prepared. This was heated to red hot and made to quench in water, and that water was made to drink. So even with that, the ionization of the water takes place, and if that water is consumed, all those medicinal properties are obtained. This is practically done in cases of neuralgia patients. Patients of neuralgia who have a severe nerve pain, in such patients, we have given ionic water daily to consumption for 1 mandala period, and there was significant reduction in the pain. The patient was none other than my own father. He is suffering from trigeminal neuralgia. We had given him this ionic water for 1 mandala period, and now his symptoms are much reduced. So that is the effectiveness of what ionic water, what our acharyas have explained, but we have forgot to use nowadays. Only if Madhuri Dixit says, we are using it. Long back our acharyas have given such a wonderful concepts. So we have to learn the Samhitas and try to inculcate in our lives, and then experience them, then explain them to the patients. Only then we will get a good confidence. So over to you, sir. I hope you are feeling
Thank you. So, we come to the last part of my presentation. So, another basic principle which we forget, whether it is Rasoushadhi or Ashtaushadhi, right? When we administer Ashtaushadhi, we take lot care, and when we Rasoushadhi, we go into mania that it will act very fast. Yes, it's going to act fast, but there is another tool for us. One tool we understood. What is that? In the first case, you understood what is that? Going as per the principles of the Samhita, isn't it? And the principle from the Samhita, it is a very simple case. He was Chintu, as he was fondly called by his parents. So he was decorating his new home along with his mother, and a fiery tingle occurred in his thigh. He started itching. Now, he used to started scratching through the multiple layers of clothes, and but the itching seemed to be extending towards the back. He removed his clothes and all, and he found that the patch was a red rash with patchy area, and that has spread from thighs to back, extending from arms and hands. Right? Now, doctor diagnosed it as simple allergy and cured it within an hour. Within an hour, it got cured by an anti-allergic pill. You know what is the common anti-allergic pill administered. And within minutes, we got cured. Now, Chintu had again the same rash and itching the very next day at the same time. The very next day at the same time. What it means? Right? Dosha are under your control or under their whose control? Yes, they are nature's under nature control. Right? In Vyadhi, they again develop their own tendency of manifesting the Lakshanas. Like we discussed earlier, Jvara Agamana. When a Jvara case comes, we ask him, when you got the Jvara? When you got the Jvara? Sir, in the evening, you got the meaning. What? Right? Like that, he got on the same time. That means, that indicates that the same dosha is undergoing prakopa in this. Right? That's one thing. He again took the pill, got relief, and was advised. Now, doctor said, you take the pill again and again. You take for 15 days. Now, what happened later? Next. Now, what happened is, on the day, she has taken, or Chintu has taken for 15 days. Now, a very good doctor. On 16th day, he left the pill. Again, he developed the same symptoms. What we understand that? There are patients who take antacids for how many years? Do you know? Like all practitioners, years together. Yes, our practitioners will definitely agree with that. We have patients who have been taking ramiprozole and pantoprazole for 10 years. The day they leave the antacid, the very next day they will get vomiting sensation, there will be no loss of appetite, there will be allergy and all symptoms will develop within a short period. That means this pill, the anti-allergic pill or an antacid, cures temporarily. We say, no, yeah, Ayurveda treatment is permanent treatment. Ayurveda is not temporary. What is temporary and permanent? What do you mean? After 15 days, he got the same itch. Means, what? In Ayurveda, it is very simple, no? Dosha, which is underwent prakopa in a Sharira Desha, at a particular kala, is in the same way as it was, totally unmodified. Right? A similar patient, like importance of kala, right? She was getting vomiting sensation in the morning. She was administered antacid pill for 10 years. For 10 years, she was taking some antacid pills. When she came to me, I told, I will give some medicine. We will detach you from that pill. She told, if I give that pill, I will get vomiting sensation. Then I told them, it's very good. I have no role to play. When you are getting vomiting, means your dosha is going to come out, and I have no role to play. Right? So the next day when we stopped it, she told, I am not getting appetite. I told, you apply for leave to your school. She was a school teacher. You apply for leave for 3 to 4 days. Then she told, till 12, till 1 o'clock I am not having appetite. See the condition. There is a doshachadana on the Agni, and you are taking an antacid pill, and forcibly, right, getting the Vega. Means what? In technical term for that. Vega? Vego Dirna Dharana Yoga Sarve Tikaya Vego Dirna Dharana. That's all happening with us daily in patients. So in that case, we observe first day. Second day, what I gave is some amount of Yashtimadu Fanta. When Fanta was given, she started vomiting. 2 to 3 Vegas she got, at the end she got Pittanta Vamana. Everything was ready. Just it had to come out. Everything it was getting suppressed by the what we have read as the proton pump inhibitors. It is inhibition. Ours is expression. Shodhana does what? It removes out the doshas. What is fit to be removed has to be taken out of the body, and what is to be kept in the body has to be kept inside the body, like a teacher does in a classroom. Right? Okay. So coming from Kala, we went there, and I will come back again to the present Kala. Right? On the day he left the pill, he developed the same symptoms as itching on the face. No. See, after this time, when he left the pill, he started getting itching on eyes, on ear, on nose. What is it? Sthanantara Gamana. I agree with it, but that had happened earlier also. Tell fast. I know that. Tell fast. You have to answer it within minutes.
Prasara.
Yes, Prasara. Where?
To Urdhva Bhaga.
Urdhva Bhaga. Where? Where in Urdhva Bhaga? Urdhva Jatrabhata. The itch was started here. It started extending here. Now there he is itching ear, eyes, nose. Yes, who told? Indriyas. Isn't it right? Very rightly told. It is Indriya. Isn't it? The doshas have become Indriyagata. What is, we read Ayurveda. What is the first chapter? Dirgan Jivatiya. What is the first chapter? Nashtangaradya? What is Ayu? What is Ayu? Sharire Sattvatma Sanyogadhariti Vitam. So, Nityagashcha Anubandhashcha Parayam. So, the doshas, what? Shariram Sattva Sautvam Chagadina Mashayam Mata. It will be in Sharira. Then it will go to Indriya. It will become Sattva. That is Manogata. There are certain part in the Manas which is mediated by the Ahara. Right, isn't it? So, what? Sattva Sautvam Shariram Tatha Shariram Iti Gadina Ashaya. There are two Ashaya for Vyadi. One is Sharira, another is Sattva Sautaka Sharira. Whenever get a time, it requires a lot of preparation again to explain about what is explained in Chakrakada and the Devanjivatiya to come to that. So one is Sharira, another is Sattva Sautaka Sharira, that is also Sharira itself. Because the part which we can touch, we can treat, and which we cannot touch, cannot be treated, that can be treated by who? Yogena Chittasya Padena Macha Madam Sharira. Yogis can treat, we are not like that. We don't know that science. So, now where it is, it has extended, you got the point. It is increasing at a specific time. It has now spread by taking what happens. That's what I am telling friends. You just observe, you will clear. I got a case of urticaria that was treated very fast with anti-allergic pills. Right? How can I treat? Do you have any medicines for that? Right? To observe what has happened. In the case, I explain to the patient the same thing. See, how is the spread you told by the mother? See, it has spread here. From here, if I treated here only, the itching was got reduced here only. It would have got reduced in this place only. It spread. You gave suppressant medicines, you suppressed the doshas. It increased in time, over a period of time it increased. And it became Shariragata. And later it became Indriyagata also. In psoriasis also you find in cases, Kitiba cases also, they first spread over the body and then they becomes Indriyagata, isn't it? Then there will be Indriya Avayavagata, then Indriya Nasha is also observed. Why can't this happen? Right? Okay. So it spread to the ear, arms, face, ear and eyelids. Doctor increased the dosage and Chintu was alright again in a short time. Chintu's mother seemed worried as the therapy was symptomatic. He has to consume the pills repeatedly, so she came to Ayurveda. This is the story behind. Now what to do? Let's go. So he was advised to avoid only one thing by the doctor. Our Ayurveda Vaidya, he told him to avoid only one thing. One thing is to be avoided. Right? Now, treatment was what? Abhyanga with Sarshapa Taila. 1 hour before going to bath, and also when he gets itching, apply Sarshapa Taila. Give some medicines to relieve itching. Some medicine means what? We gave Rasoushadhis in this condition. The observation improved within few days. The patches decreased in number, intensity of which decreased, and finally didn't reappear. Right? We got it in. Finally they didn't reappear. Simple. Treatment was very simple. But what was that? What was that? Next. What was that? That was advised by the doctor, Ayurveda Vaidya, to avoid. Right? Something he told you, avoid. Now, the clue is winter season. Okay, that in some case you will find very ashy. So it was a winter season. Right? So on that, I got a clue which I extended and tried to find it out. What was that? Next. So, Chintu was a lean child. So when a lean child is there, then parents will say, "Isko mota karna." So what they will do? They will give some Brahmana dravyas. So here, Chintu's father decided, since it was winter season, there is a method of administering anda, eggs, in the winter season, so that the child becomes healthy. What your Samhita says, in Agrasandrini Adhyaya, what is mentioned? Kukuto Balyana, or Kukuto Balyanam Shreshta. So Kukuta is Shreshta in Balya. So they didn't want to do Kukuta Mamsa, they gave anda. So anda or the egg, what we use is what? It is Kukuta. Do you agree with that? Right. Okay. With that we will move. Because his father has also started taking the Kukutanda in the same age during the winter. So he thought, I will make my son sturdy by giving Kukutanda. Was he wrong? He was not. He was right. Now, coming to the point. The winter season was also best time for giving egg in the morning. So he thought, let us give on the empty stomach. So people go to walking. Have you seen? I have seen many senior citizens go to walking. By the end they complete their vigorous walking. They come outside, take some eggs and go out of the house. They go to their house. Is it wrong? Alright. Because they are having appetite. They will eat it. No? What problem you have? Let them eat Kukutanda. Right? Then they will go to house and do snana. Is it right or wrong? Then what it is going to do? It is going to take away the doshas from Koshta to Shakha. That is the main reason for Kushta. If you get a Kushta case, Rokvikara case, then this is a 100% cause. People have started consuming food, then taking bath. Right? It's clearly mentioned. Koshta to Shakha Gamana, Shakha to Koshta Gamana. Remember in Charaka what is mentioned. Right? Doshas will move to the Bhakt region and cause many vikaras. Now, on empty stomach, this was given. Now, Chintu appeared to improve in physical health a bit, but his itchy patches started coming. Now, next. Right. According to Ayurveda, where anda have been discussed. Right? They have been discussed in Mamsavarta. Right? What are the quality of an anda? Because different eggs have been mentioned. What are the qualities of that egg are the qualities of egg are same as that of the mamsa. You got the point? Kukuta mamsa is there, the kukutanda is having the majority same properties as that of the mamsa. Otherwise, what they will do is, they will mention the virya, vipaka separately. Charaka has a very simple technique. If it deviates from the normal law, then he will give it, that is, the vipaka and virya, how they have to determine. Only rasa is enough. Only rasa is enough, isn't it? Katatikta kashayana, vipako, prayashakatu, amlomdam, riyate, swadam, mudram, davanastata. So that's how we understand vipaka, virya and all. It's very simple. There are some quotes which you should understand and by heart, and you should understand that the madhura rasa is having madhura vipaka. If it deviates, then he will say, no, the virya is, the vipaka is katu here. You know Shanti, what is its vipaka? What is its rasa? Right? They are not aligned. They are not aligned. They have to mention, see, this is like this. When Charaka has mentioned something, Samhitakara has mentioned something means that's a deviated form, that has to be clarified to you. Otherwise, something is mentioned as Madhura, then you will say, sir, whether it is Madhura vipaka, no question at all, it's Madhura and Shita, understood. That's how the Samhita is written. So according to the exercises, now, next. So according to Ayurveda, eggs are what? They are mentioned in Mamsa Varga. They are Guru. And what are Guru? Guru is one which is difficult to digest. Guru and Lagu, the concept you know. So when the Guru Dravya is not, it becomes apakva, then what happens? That Ama, it will increase all the doshas. Because why I am telling, in this case it happened that we got all the lakshanas, the prasara, right, the pittatva, the fiery, that is the red color, and the itching, right? Some dosha may be predominant, but it causes usually dosha prakopa. Further, the tendency of itchy patches increases in winter. Lot of patients, even vegetarians also, we get having shita pitta lakshanas and all. So winter, administration of kukutanda, that to an empty stomach. To crown to all this was given to a child which has not previously consumed the kukutanda, right? If kukutanda was given with rice, it would have been a better choice, I don't know. Because every dravya which is given with the satmya ahar is not going to cause any problems. So satmya ahar is very important. You are eating jawar roti, you do with that. You are taking chapati with goduma, you give it goduma. If you are shali consumer, give it shali or ragi, right? So even the researchers have shown that if you develop hives or other physical symptoms of eating eggs, you may have an egg allergy. One of the most common allergies, especially found in childhood. So this is American College of Allergy, Asthma and Immunology, which clearly mentions that children are very prone to this hives when on consuming an egg. So this is called as egg allergy. So when it is said from there, we agree with that. It is clearly mentioned in our Samhita, isn't it? We really observe these in the patients. Right? Isn't it? Now I will ask you, Rasoushadhi or Kashtoshadhi is going to act in this condition or not? It will definitely act. When? The fundamental principle of Rasoushadhi or Kashtoshadhi is that Sankshepa Kriya Yoga Nidana Parivartana. How Charaka said about this? इसके बारे में चरक ने क्या कहा, कैसे कहा? संक्षेप तक क्रिया योग निदान परिवर्तन किसने बताया? कश्यप ने बताया, कहाँ पर बताया? उत्तरस्थान में नहीं बताया, भूल गए? That you are right. It's an uttara. How Charaka has said this? हेतो रसेवा विहिता यतैव जातस्य रोगस्य भवेत् चिकित्सा. हेतो रसेवा, असेवा, न सेवा. Don't make it ईशद सेवा. नहीं तत्पुरुष समास can also be made ईशद सेवा. It is न सेवा, नकार. Right? It is a vidhi. Rami morte uttishte. Swasto rakshartha mayusha yadi. Right. So, what is mentioned next? So, what you have to do? You have to read the Samhitas properly. It is very clearly mentioned everywhere. What is happening around us? What is happening in our patients? Isn't it? So, the effect of all these was the root cause. Next. So, what is the disease? You know this. It is Shita Pitta Udarta Kotha. Because Dr. Rostok had told that we have to take into consideration other aspects also, that other samhitas also in the presentation. So I took the reference as a base from Charaka as Nidana Parivartana, but this is from Shita Pitta Udarta Kota is from Anandana. So Kshanikotpada Vinasha Kota iti nigadyate tatmehi is given in Madhukosha Vakya Vijayrakshita Shrikanda Datta. Next. Right? Yaihe to be promoted. Next. So, wasn't there any some value in searching the root cause? You agree with all that, right? The treatment plan in Ayurveda is not just to heal the body to medicine, but to eradicate the root cause. हम बोलते हैं कि हम समूल विनाश करते हैं, क्या समूल विनाश होता है? जब मूल को समझे तो विनाश होता है ना? मूल को समझे बिना कैसे विनाश कर सकते? You don't know the root. If you cut the tree, it will sprout again. But it is wise to suppress. Is it wise to suppress the symptoms with medication that of temporarily? That should happen. Should not happen with your Ayurvedic drugs also. आप भी अपना आयुर्वेदिक दवाइयों को सप्रेस करने के लिए भी है, जैसे कषाय रस वाले द्रव्य है. If they give relief in something and they suppress the doshas, don't give it. Whether it's a Rasoushadhi or a Kashrashadhi. The rasa concept is very important next. So one should also not forget that temporary solution often becomes right. So this is what we have to tell to the public. Temporary solution often don't become cause for the permanent problems. So what is such short, but everybody is behind such short-term happiness. सबको ऐसे ही दवाई चाहिए. Everybody wants short-term happiness. What is this short-term happiness called in Ayurveda? Yes, it's told in Charaka, isn't it? Yes, what is it called? Tadat vasukasodnesh. Bhavesh radhyonu rajyate. Rajyate natu vidnyata vidnyani yamani kake. So beautifully he has told. So what is that? Next. So tadat vasukasodneshu. Bhaveshu adhyanu rajyate. Rajyate natu vidnyata. So this tadat vasuka is not desirous. So for a person who is ayushkama, right, who desires for a dirgha jivana, he should never go behind such things. That you need to educate to the public also. Once you get the result, they will bring lot of patients to you. They will tell there is no need to consume the cetirizine or the anti-allergic pills again and again. Ayurveda has answer for this. Patient themselves will tell to the public, and then that is how your clinic and your Vaidhyatva is going to sprout and grow. So next. So what is the principle of line of treatment in Shita Pitta? Right, next. So it is Abhyangam Katutailena, Svedashtoshneena Varina, Zekashtoshneena. Zeka means Snana. Zekashtoshneena Varina is different. Udarde Vamanam Kare, Patolarishka Varina. So what I did here is Abhyangam Katutailena. Katutaila is Sarshapataila. Sarshapataila Abhyanga is the best Taila Abhyanga in Shita Pitta. You remember, it's very extraordinary action. No need to go for later Tailas. It's not wrong using other Tailas. But I got very good result because that path, conversion is to be done now. From that pitta, that conversion happens very fast and is relieved of the itching. Next. Now I got another reference. Throughout the last 15 to 20 years, I have been administering only one thing. In Udarda Shikapita quote, written is there to know that I don't go beyond one drug, that is Saguda Deepeka. Deepeka is Yavani, Yaran Koptikam. Yavani, Ajwain. So, Saguda Deepyaka means we call it as Buddha Yavani. Right? In Sharanada you might have read Buddha Sarkampa, Buddha Nagaramba, Buddha Prayamba, Buddha Jirakampa. There is a unique method of administration of the Kashtavshadhi with Buddha. Buddha Shunti, Buddha Arthaka, Buddha Pippali for Adho Nabi, Buddha Shunti, then Buddha Arthaka for Pratishaya, Buddha Jiraka for Nutra Praksha. Such beautiful yogas are there. And this yoga is Buddha Deepyaka, that is Buddha Ajwan, Buddha Yavani, that is very effective in relieving the symptoms. It's very, you can consider it as a very specific drug of choice in such conditions. Okay, then different sutras have been mentioned there, right? In Yoga Ratnakara and other you find all these sutras. So you can read it different way. But the classical method of understanding a disease and administering drugs. You can administer Haridra Khanda. You take Brad Haridra Khanda, then Bhasmas are there, Rasoushadhis are there. So how to administer that? What are the conditions? Right? You can have a detailed discussion on that. So the principle is that if you do Nirana Parivartana, then very simple drugs, as sir discussed very well regarding the local application of Vairika. Another application of Vairika is in Visarpa. In Visarpa, Vairika is having very extraordinary action. Right? So just to apply Vairika, the Visarpa stops spreading. Right? It's very specific. Vairika and Vivechanam. So a lot of miraculous, what we call yogas, single drug yoga, single drug therapies are mentioned in Ayurveda. But we need to understand as per Samhita, so follow it properly and definitely you will become a very great Vaidya. Wishing you all the best by completing.
So we are coming to the last session by Agnihotri sir.
concluding part of tabletop recipes for your successful clinical practices. So one more simple remedy what you can in clinics along with other formulations is somatic care. Very excellent preparation, and it is said that the somatic care, which contains again arsenic preparation, arsenic is the best and has an affinity towards skin and lungs in both the conditions. Patient with eosinophilic count increased, allergic bronchitis like cases, even there we can go with the somatic care. At the same time, even in Kushta-Vikaras, especially in cases of Vicharchika-like conditions, Rasamatic is a drug of choice. In Rasamatic, in Kushta, if you want to administer, you can go with Nimba Vijachona, and if you are administering it with in Shwasadhikara, you can go with Haridrakanda. Mixing Rasamatic rasa with Haridrakanda has excellent results. All Rasoushadhis, they have their own affinity organs in the body, like sulfur has affinity towards the skin, Abraka has affinity towards Pranavarshodas. So similarly, Rasamatic care, because of arsenic preparation, they have affinity towards the lung as well as skin. So in both the conditions, a dual action can be performed with the Rasamatic care. Among parpadies, there are several parpatic preparations. The common type of parpadi which is very essential in your clinics is Panchamrita parpadi. Why? Because you get a patient who doesn't come up with the complaint of the Grahani Vikara. Instead, secondary to Grahani Vikaras, many other complaints he will come up with. He may come up with increased Amla Pitta, secondary because of Grahani. He may come up with Arsha-like symptoms, secondary to Grahani. Many times, we keep on giving medicines to Arsha or Amla Pitta conditions, but we never ask what is his nature of defecation. Many patients do not have formed stools. They never produce formed stools. The formed stools is a sign of Agni, with which we can assess the Agni. In such conditions, when a patient has, when we probe into the patients and when we ask leading questions, only then he says he is suffering from urgency, he is suffering with, he passes mucoid stools. Whenever he eats, he feels like defecating. All these conditions are very common in persons who are habituated with street foods. So they are the centers for IBS. Many come with the complaints of malnourishment. They don't come with the case of IBS. Only when you ask how about his stools, he then explains it is not good. He passes 3 to 4 times mucoid stools, unformed stools, all such. When you start asking queries, all such history will be presented. Panchamrita parpadi is a Ramabhana in such conditions. It's a drug of choice in such conditions. Combination of Kachali, Paranandaka, Loha, Braka and Tamra Basma in various proportions. It helps in curing the inflammation of the gut, motility of the gut is improved, and the increased frequency, whatever is there, is definitely controlled with this Panchamrita property. Essentially, you should have this drug because many are suffering from such complaints. Every third or fourth case in my OPD, they have the history of IBS. Even sometimes they come with low sperm count also, libido, loss of sleep, so many varied complaints. But when you ask his gut history, only then it is revealed why this is happening. So first treat the gut, then treat the other conditions. In that context, Panchamrita is a drug of choice. Similarly, in Parpatical Pass, we have one more addendum from Vaiti Acharya, Acharya, Shweta Parpati, she explained in Bhuta Pracharita. So this Shweta Parpati is as good as very good alkalizer. It increases the urine alkalinity and thereby flushes out the microbial flora from the urinary tract, and that's how the urinary tract infections can be treated with the Shweta Parpati. But this is a very simple preparation which you can keep it in your clinics. And in meteorological conditions, we have Bola Parpati, a drug of choice. Instead of giving a preparation which has a Bola Parpati in it, better give the Bola Parpati itself along with Puputana Plasma and Pushana Vajurna in DOD cases. You get very quick results. So this is the thing what we have seen in our clinics. So many such yogas you can even come across when you start reading the Samhitas, when you start reading the Rasa classics. Even there are certain Bala like preparations explained in Charak Samhita, in Grani Vikara, which are excellent preparations in Grani Vikaras. So such simple preparations, you can keep it ready and in your clinics, which are very handy and which are when you prescribe them along with the other classical drugs according to the dosha imbalance, very quickly you get the success in your clinics. To conclude, there are no such medicines, there are no such things in your facility which cannot be used as a medicine. That's why they say, Vivechanam. It is you people who have to use those things in an appropriate way to achieve the success in your clinics. So with this few tips, so whatever I have learned from my acharyas, from my teachers, and from my subjects, from my patients, all those things I have shared with you. So hopefully you people start reading Samhitas and come up with much more good knowledge for better practices. Thank you.
So hope you have taken a holy dip in the sangam of caste and Rasoushadhis. In this kshetra of Rudra, who is Abhimani for Manas, let this Rudra give a good Manas, good yukti so that we can practice in a better way for the betterment of humankind. And as rightly said by Shashwata Acharya, Ekam Shastram Adhyayana Vidyat Shastranishchayam Tasmat Bahushutam Shastram Vidyaniya Chikitsakaha. So you should have the multi-dimensional knowledge. Let the knowledge flow from all the horizons. So by saying this, I want to conclude that Ayurveda is not an alternate system of medicine. It is the ultimate system of medicine. The thing is, I thank both the Acharyas who have given a Brahmana effect for us. Vidya Brahmananam Sreshtam. They have updated our knowledge. So let us also get updated, because patients, they try allopathy, homeopathy, Tirupati and they come.
Agnihotri sir, Vaidya Pavan Kulkarni sir and Vaidya Shrinivas Wadeyar sir for the exceptional session. Thank you sir. Now I welcome Dr. Saurabh Kulkarni sir to kindly felicitate our today's resource person and moderators, the esteemed dignitaries of the session, as token of respect.